Hello, today we'll be looking at how to work with patients with Alzheimer's disease. Alzheimer's disease is a brain disorder that gets worse over time. It's characterized by changes in the brain that lead to deposits of certain proteins. Alzheimer's disease causes the brain to shrink and brain cells to eventually die. Alzheimer's disease is the most common cause of dementia, a gradual decline in memory, thinking, behavior, and social skills. These changes affect a person's ability to function. The early signs of the disease include forgetting recent events or conversations. Over time, it progresses to serious memory problems and loss of the ability to perform everyday tasks. Medicine may improve or slow the progression of symptoms. Programs and services can help support people with the disease and their caregivers. Working with patients with Alzheimer's disease. Now, working with this kind of patients can be so challenging. The care required is extensive, challenging, and nearly constant. Here are some tips to guide you. 1. You need to be flexible. No day is the same when working with Alzheimer's patients, so caregivers need to be fairly flexible to keep up with their day-to-day needs. And due to the nature of these illnesses, the diseases will progress with time, meaning that the patient will experience a progressive decline in independence. As patients lose their independence and grow more independent on caregivers, it is important to be able to adopt routines. Patients can be unpredictable since their thoughts are not rooted in reality. Caregivers may find that patients have repetitive requests. For example, if a patient insists on wearing the same shirt every day, the family might want to consider purchasing a few of the same shirts so that they can easily be worn while the others are being washed. Number 2, focus on the individual. Alzheimer's disease certainly do not have patterns and characteristics. Alzheimer's disease certainly do not have patterns and characteristics, but no two patterns have identical symptoms or disease progression. As such, what might work for one patient might not work with other patients. When keeping patient care flexible, a caregiver can tailor care plans for individual patients that will help them deal with the everyday confusion and frustrations. Number 3, make it safer. Due to the nature of the disease, Alzheimer's patients will need to have much safer environment than they perhaps live before the disease onset, with lower problem-solving abilities and a less effective judgment on situations. Even simple situations can prove dangerous for these patients. Here are a few things to pay specific attention to. 1. Lock everywhere. 2. Fire safety should be available. 3. Prevent falls. Don't forget nutrition. One of the lesser known side effects of Alzheimer's disease is that eating and drinking can become a difficult task for patients if they seem to be struggling to chew, a common symptom. The types of food given to the patients might need to be adjusted. Make things easier. Patients may experience that certain tasks are not as easy for them as they used to be, which can lead to frustration. To minimize this and to help the patient feel more at ease, make small changes throughout the day by establishing a routine. Go slow. Don't forget the common tasks will take your patient longer to complete. Give them choices. Keep them busy. This is where we'll be stopping the class for today. Thank you.